Lisa asked me to share with you the passion that we have in our office to actually create this protocol for our patients, and I'll let you know why it was that we ventured in the area of xylitol. Obviously, the fact is kids love candy, and although we have parents who come into our practice and try to talk into their blue in their faces telling us that their kids don't eat candy, we know that's not the truth. They love candy. They're going to eat it. So we figured, as hard as it is to try and get the kids to follow our home care recommendations, brush for 2 minutes in the morning, brush at night for 2 minutes, floss, do everything that we need you to do, we found that the kids just weren't doing what we wanted them to do. It's the reality of our practice. We try our best. We try to inspire them as best as we can. But let me tell you, when we mention candy to them, all of a sudden their faces light up, and they can't believe that their dentist is recommending candy, and that it's good candy, and that it's going to help them, and they get really excited, and they look at their parents like, please tell me you're going to buy this candy for me today. So that's the experience that we have gotten from our patients. And it's been really easy to convince parents about it too. And I'll talk, somebody had mentioned or asked about how can we inspire our dentists to actually work with us to create a protocol like this. And I think it has to do a lot with the passion that we share. With my dentist, we saw a lot of decay, and we work in an affluent area. So we work in an area where parents are driving in with very nice cars, 3-carat diamond rings, and we still see an increase in dental caries. And it's really sad to have to work on a 2-year-old who has early childhood decay. So candy's great for the kids. The adults love candy. We're actually finding in the practice that when we place our children on the candy and we talk to them about the transmission and not sharing drinks and not sharing cups and not sharing forks and spoons, parents are saying, well, we're a loving family. We're going to do that. We share our cups. We drink from each other's bottles. We do that all the time. So I think we need to be on the xylitol too. So that's why we have so many patients on xylitol, because we haven't only put our pediatric patients on the xylitol. Our parents are actually walking out of the practice with packages of gum that have 600 gums in them, and they're also going ahead and placing themselves on that protocol because they want to go ahead and prevent caries transmission between each other. Why our protocol works. The reason that it really does work is because everybody in the office is on board. It was hard. We have about 26 staff members in our office, and to get them inspired is very difficult. When we first introduced the protocol, I created a book with bookmarks, and I'll show you what that looks like. They were a little bit overwhelmed because we work in pediatrics. Fortunately, we do work in an office that has assisted hygiene. So as hygienists, we're able to really practice and work with our patients, and the assistants are helping us through the course of the appointments. But everybody was nervous. Some of the hygienists were thinking, well, how in the world are we going to go ahead and review xylitol with parents when we have to do IOC pics, x-rays, educate them on brushing? How are we going to work this in to our 30-minute appointment? There's just no way we can do this. So probably the first month that we started the protocol, we had a little bit of resistance from some of the team members. And after 3 months, when patients started coming back for their recare appointments and we started to see less plaque and we started to see better health of the gingival tissues, the other hygienists and the assistants all of a sudden started to get excited. And they're like, wait a minute, this really does work. So when they started to see the results, now every single team member in our practice is gung-ho about doing this. And I would probably say out of all our patients that come in on a daily basis who need a xylitol protocol or would benefit from xylitol, probably about 80% of our patients walk out with the products from our office, which we are really excited about. We do have parents who are hesitant and say, so how much money are you trying to make on us? And we do hear that, and we actually, our response to them is, actually, as a practice, we would make more money filling your children's teeth than we would putting you on a protocol that's going to prevent dental decay. And when we do say that to them, they look at us like, oh, I guess you're right. So we do try and tell them, look, we're not trying to get rich on xylitol. We really do want to have a preventive mentality, so that's where we've gone with this in our practice. So this was one of the cases, and we have a lot of different protocols that we use. And one thing that we have learned is that the kids do get bored if you put them on the same thing. Sparks candies are the #1 product in our office. The kids absolutely love the Sparks candies. And I'm constantly calling Lisa because I can't keep it on the shelves and telling her, you need to send me another 10 cases of the Sparks because the kids really enjoy it. And we are putting them on the 8 grams, about 8 grams a day. And that's just in case they do miss one of the doses that we recommend. At least we know that they're getting over the 7 grams, close to that 10 grams that is being recommended. We are very big, too, on the XyloSweet packs. And there is a company that sells water bottles that have 4 grams of xylitol in them. The water bottles are about $2.40 each bottle. So it's really expensive to integrate those water bottles that have the pre-made xylitol. So in going with that notion, what we have our parents do is we actually have them make xylitol water. So we put the little packets of the water in a bottle, and we have them mix it up, and we have them sit it in. We tell them it has to be room temperature water. So they put the packets in, they let it sit overnight, and then they send the water in with their kids to school. So the kids are drinking water throughout the course of their school day because most schools do allow kids to drink water throughout the day, so they're drinking water that is sweetened with xylitol. And the other thing is they're getting 4 grams by doing that throughout the course of the day. And then what we do is we always recommend to parents, if we eat, we put xylitol in our mouths because they think, wow, this is going to be really hard for us to do it. And I'm like, well, do your kids eat every day? Do they eat breakfast, lunch, and dinner? Do they have snacks? And they're like, yeah. So we just recommend them. If they have food, always keep the xylitol with them. It's part of their meal. So for lunchtime, parents will pack the 6 Sparks candies in a sandwich bag for them and put them in their lunchbox and send the kids off to school so they drink the water throughout the day. And then at lunchtime, after they eat their lunch, they just throw the little Sparks candies in their mouth. We've had a little bit of resistance with some of the schools in our area because they think that xylitol is a drug, so the nurses have to administer it. So we have had to educate the schools, and we have had to send research showing the benefits of xylitol. We've had to speak to educators, letting them know that, no, this isn't a drug that's prescribed from the doctor. It's okay for the kids to put it in their mouth, just like you allow them to eat fruit snacks and fruit roll-ups during school. Instead of having those snacks, their snack after lunch is the Sparks candies. So it works really well. The educators, they're actually starting to think about it. They are letting the kids do it now. So for the schools that were fighting us a little bit on it, the parents are saying and coming back and saying it's been fine. This is a special needs patient that we had, and you can see all the plaque on the left-hand side here. And she has Down syndrome. She also had a congenital heart defect, and the mom was really concerned because we spoke about the plaque and we spoke about the bacteria getting into the bloodstream, especially because she's a higher risk patient. And we talked about the different options that we had, and for her, she didn't feel her daughter would be okay with eating the candies or chewing the gum. She thought maybe she would just swallow them or just not be able to do it. So she said, well, my daughter will drink the water bottle, so how about if we just give her 2 water bottles throughout the course of the day, sweetened with the xylitol. And when she came back 8 weeks later, you can see the difference. So she really did much better. And any plaque that she did have, mostly in the posterior areas, wiped off very easily. So we were able to just get through her visit a lot quicker than we were able to do other visits. So that was great. This is a 15-year-old patient who came in, and this mom was in tears because the patient's home care was very poor, and then on top of that, she had braces. So we know how hard it is to remove the plaque when we have all this in our mouth. And again, we put her on a routine with where she was drinking the water and actually eating the Sparks candies throughout the course of the day. We also feel that she may be having a reaction to the actual orthodontic appliances here. So they're looking into other things too, because she did come back, and this is the plaque that she came back with 6 weeks later. Never did that mom have that child with teeth that had no plaque on them. So she was very content. She sat next to me in the chair, and the mom was actually crying. The assistant's looking at me like, what is wrong with her? But she was just excited because for the first time, she actually was able to see a difference in her child's plaque control. And they help this young girl does have special needs also, so they do help her with brushing, and they always had a lot of issues removing the plaque. This is before I polished or even went into the mouth. So this is before I worked on her. And that's 12 weeks later. So I see her very frequently, just trying to stay on top of her home care, and as you can see, also the gingival health there. All right, so here's the binder that we actually keep in the room. Just to let you know, too, how I got our dentist on board. Lisa Stillman was giving a continuing education course, and Montgomery Bucks had offered a free 1-credit continuing education course with an open bar. So I went to my dentist and I said, we have to go to this course on xylitol. It's awesome. But better yet, there's an open bar for an hour, because I knew that I would get all the hygienists on board and the dentist on board. So I didn't care what it took. I needed to try to get her to that course. So we went to the course, and sure enough, there's an open bar before Lisa has to present. So there was a lot of happy attendees at her course that day. And so I got them all to go to the xylitol course. And then once they sat through it, a couple of them were a little bit, loud. And I went back to Lisa at the end and I said, Lisa, I apologize for some of the girls on our team, but I promise you that when I get back, you are going to be getting phone calls from me to order these products. So we left the course. The next day I went in and we had a talk about xylitol. And I went into the office and I said to Chris, I really feel we need to move in the direction of xylitol. We are seeing so much decay. And I did go back to get my expanded functions dental assistant permit, because I thought, working as a hygienist, I can also jump into the restorative aspect of dentistry and work with the kids and make sure that they were all okay while they were having their teeth filled. And I was so excited about that. I don't know where my slide went. It's not in the order, but one of my first patients that I worked on was a 2-year-old, and she had rampant caries. And here I am having to work on her, and I'm a little nervous because it's the first time I'm going to be working in the practice and doing the restorations on a 2-year-old. And I had to anesthetize her for the procedure. She's crying hysterically, so I grab her, and again, I'm just moving her around in the chair. And I was in tears. I was really trying to just contain myself as I'm working on her, because I'm thinking, why is this happening today? When we have so much to prevent dental decay, why are these kids still struggling with rampant caries? And that was one of the reasons why I wanted to get the office to this course. So I talked to Chris about that. And I said, Chris, give me the okay to order the products we need to get this program started. Because I promise we're going to have parents that leave here inspired, and we're just going to make a huge difference in the community. And you don't have to fill and drill to make a profit, or so that you can look at your checkbook and say that I can. It's going to be, your practice is just going to grow because of the reputation that you care. And because she is a very caring individual, she said, absolutely, Lisa, whatever you want to do. So it took me weeks to sit and work on the protocol. Created the binder to make it easier. In the binder, we have bookmarks, we have little order sheets. And as I said, the whole team had to be on board for this to work. So these little sheets here actually with the bookmark have the different regimens depending on what the patients want, whether they want to do the Sparks candies and gum, just the Sparks candy, water and Sparks candies. And it helps our assistants who sit behind us there. We just tell them what choice the patient wants, and they fill everything out before that patient leaves the chair. So everything is already filled out. The bookmark is created because we know that when we educate our patients and we tell them this is what I want you to do they not come back in 3 months and say, you told me what? So we wanted to make sure that when they walked out of the office, they have the bookmark on exactly what it is we educated them on and exactly how it is we want them to use it. So they take that home, they put it on the refrigerator, and they have it as a reminder of how to use it, because we know, as Dr. Nobi was saying, what happens if we eat a whole container of Sparks candies because they taste good. So we needed to make sure that we were okay with that. So these are the variety of regimens that we actually have in the practice. So just so that you can see there. And then there's the patient bookmark that we created. You can see that we do it after meals, so after breakfast, after snack, after lunch, after snack, and then after dinner. So every time we take food in the mouth and the acidity drops, we're trying to go ahead and balance that. And then there's the little product order form, and like I said, we put the family name there, and we just take it right up to the front, and there's our Smile Saver store. And that's organized for this presentation, but like I said, I'm constantly going back to fill this supply because we just can't keep it in the actual office there. And that's one of our office team, just getting the products ready before the patient comes up to the front desk and processing the order there. And here's our history of sales, and this was, as I said, 2 months ago. So we've sold 8,148 tubes of Sparks X candies in 8 months. So, as I said, in order to inspire, we have to be inspired. We have to be passionate. We have to show parents that we truly do care about their kids' dental health. And when they see that that's true and we really do feel that way, they jump right on board because they know that we're being honest and we just want to help them and help their children. And that's some of our kids who love our Xylitol. Our parents, this is a mom who, when we were talking to her about Xylitol, she ran to her purse and grabbed it and said, look, I already have it. So our parents do come in, they are aware of Xylitol. And this is our office team. And this was during Pirate Day. We all got to dress up and come into the office, and the kids got a real kick out of this. But this just gives you a sense of the personality of our office team. We really are a family. We really do work together, and we strive to just do better for our patients. So thank you. Thank you for the time to share.
If Lisa is doing it, it can be done. So thank you for sharing your enthusiasm and what works in your office.